I placed over 10,000 dental implants, but this morning I had to tell the patient we're not doing this today. And here's why. Hey everybody, Dr. Choi here, board certified periodontist since 2011. Today I'm sharing two real cases from my practice. One where I had to stop mid-procedure and completely change the treatment plan, and another where everything went perfectly. I'll show you exactly what I look for to determine if you're a good candidate for immediate implants. But more importantly, stick around until the end because I'm going to give you a free downloadable guide with the complete summary of everything we're covering today, plus the 10 essential questions you need to ask at your implant consultation. You don't want to miss this. It could save you thousands of dollars and months of your time. Hey everybody, Dr. Choi here. So today I had two immediate dental implant cases that I wanted to go over because a lot of times patients want to get dental implants at the same time as they get their extraction of that tooth. And I want to kind of go over why that could happen for you or that might not be the best choice for you. All right, so I want to go over this case that I had this morning. So the tooth in question was the patient's lower right first molar, what we call tooth number 30. Now, I also took a photo of this and you can see, but on the x-rays, you could see that this tooth was actually fractured off. So this patient who was referred from another general dentist in the area sent this patient over because this patient's crown kept just falling off. And so the doctor said, hey, you just need to go see Dr. Choi. He's going to place an implant for you because unfortunately, this tooth is root canaled and there's just not enough tooth structure up top for this crown to just not keep coming off. Now, we also looked at this patient. He's a big guy, he's got strong jaws, and also we were able to take a look at his adjacent teeth and we knew that this patient had a history of grinding his teeth. And so that's probably what contributed to this tooth coming off. Now, let's go into details as to why we can or potentially can't do an immediate implant on a root canal tooth. So now, one of the things I've mentioned in other videos is I don't exactly love root canals because unfortunately sometimes if the root canal has been around for too long and there's been a long-standing infection, the best thing might be that's most predictable for this patient is to take the tooth out, do a bone graft, let it heal for about maybe 5-6 months, then go ahead and place the implant. Again, that's a little bit longer than we traditionally like to wait, which is about 4 months for a non-infected tooth. But again, for a root canal infected teeth, I like to wait a little bit longer. Now, this tooth doesn't have a root canal infection that we were worried about. Again, we were just worried about this tooth not being a good long-term candidate, for success, a good long-term prognosis for that tooth. So we decided, hey, we're gonna take the tooth out and we're gonna place an implant. Now, a lot of times, if you know anything about implants, you can take a tooth out and then you can bone graft it. You can wait about, let's say, 4 months, and then you can get an implant in there. Now, I give people this analogy all the time. It's like taking a pole out of the ground and now you got a big hole there. So what you're gonna do is you're gonna put some wet concrete in that area, you're gonna let it set, and then you can go ahead and drill and place a new hole. Now, similarly, that would be the same thing because when we take the tooth out and we do a bone graft, what we call a socket preservation, what we're going to do is we're going to put bone particles in there, sterile bone particles, and we're going to let that basically turn into your own bone. It doesn't really turn into your own bone. It goes through this process of where your osteoblasts and osteoclasts are going to go in there and rebuild your own bone, but I'm not going to go into details about that. But long story short, when you basically take the tooth out, you place a bone graft, you wait 4 months, then you have another surgery where you actually go ahead and you place your implant, right? And so now the pros and cons of this is it's a very predictable procedure, but the problem with it is that it's 2 separate appointments. So if you're like a lot of other people and you don't have a lot of time or you don't want to go through 2 different procedures, then it sounds very attractive to basically take the tooth out and then place the implant all on the same day. So again, that's called an immediate implant. All right, but if you've seen cases like this, then the exact discussion that I had with this patient was that I told this patient, listen, we may or may not be placing this implant for you today. And what that's contingent on is how easy is this tooth gonna come out, right? So, and I told him, listen, I've been doing, dental implants for 16 years when you include residency, and I've, done well over 10,000 implants in my career. But for me to sit here and predict how easy this tooth is going to come out and what your bone's going to look like for me to be able to place an implant, I'm not exactly sure until I really get in there. And so I told him maybe there's probably going to be like a 40% chance that this implant was going in today. And sure enough, what happened was I took the tooth out, and the way that I took the tooth out was that I actually sectioned the tooth, so I cut it down the middle. And because this tooth had been root canaled, it was very difficult to remove. So again, even though I've extracted many teeth in my career, the whole objective when we're trying to take out a tooth to do an immediate implant is we need to do as little damage to the surrounding bone as possible. And so what I did in order to do that was I cut the tooth in half, and I had to unfortunately remove a little bit of bone around the edges, and then I was able to get the tooth out. Now, after I got the tooth out, what I was then trying to do was, number one, I had to look at the 3D scan and take into account how far away his nerve is. And so I had this 3D scan, and it told me that I was about 20 millimeters away from his nerve. And that's actually plenty of distance because, number one, when I'm drilling for his implant, I definitely don't want to drill into his nerve. But the other issue is that I need to make sure that I have enough native bone, his own jawbone, to be able to drill that implant into. Now, the way that we achieve that is something that I love, the VersaBurrs. It's a great way to get into what we call the septal bone, the bone between the roots, and basically be able to place an immediate implant. But the amount of bone that was in that area was not ideal. And so I actually started preparing to drill, and the patient unfortunately just didn't have enough bone there. So I told him, listen, I'm always trying to do for patients what I would do in my own mouth. With what I see inside your mouth at this point, with how much remaining bone you have, with the septal bone, I wouldn't go ahead and place this implant today. I would actually recommend we're going to place bone graft. We're going to let it heal for about 4 months, and then we're going to go ahead and place that implant for you. So the patient was happy to hear that. And so he's going to be coming back in, again, 4 months, and he's going to have nice solid bone because that bone graft that I placed in there is going to heal up nicely, and it's going to look like jawbone that's never had any issues there, that's just been missing a tooth for a while, and we're going to go ahead and place that implant. Now, I wanted to say another thing about the nerve. Not everybody has a nerve that's as low as his, and that's why it's critically important that whenever we're examining a patient and we're seeing whether they're going to be an immediate implant, if we can do an immediate implant on them, if they're going to be a good candidate for that, is we have to really make sure that that nerve is farther away from the roots. The closer it is, the more chance that we have to potentially hit that nerve. Now, that's always the case for any dental implant, but after you take out the roots from a tooth and you have big holes there, and then you have a slim amount of bone, so you have very little bone, and then you don't have very little bone at the bottom of where the roots used to be before you get close to the nerve, that makes it extremely challenging to go ahead. No matter how many implants you place, it makes it very challenging. And so you lose some of the predictability that you would have with some of the other cases where the nerve is further away, as in the case with this patient. And another thing I'd like to say is that, again, when you have the big holes in your jawbone after you remove those roots, it becomes, whenever we're trying to place that implant in the bone, the implant in that septal bone, number one, again, it is challenging. The state of the tooth is very, basically, a big predictor of how likely we are to place that immediate implant. If it is a tooth that just needs to come out and the patient has plenty of bone and the teeth aren't root canaled, so they're not brittle, and the teeth isn't heavily decayed. So long story short, is that tooth easy to remove? I like to give people this analogy that if I went to my backyard and I was removing a steel post from the ground, then I could probably remove it pretty easily. Now, if that steel post has been there for a long time and now it becomes rusty, and also so like when I'm shaking it back and forth and it breaks off at the ground level, then that removing the remaining part from the ground, and how much soil I have to remove, that's going to cause more damage to the surrounding structure, whether it's concrete or soil around my pole down there. And similarly, if my tooth is compromised in the jawbone here, then I'm going to have to remove more bone, which is not going to be good for my dental implant. And also, along that topic, the root canal, what we do with the root canal is we're hollowing out the roots. So when I go back to my prior example, not only did my steel pole break off at the ground because of the rust, but now the pole has been hollowed out in the ground. So you could see that there's multiple factors working against us to get this root out, what we call atraumatically, so that we have a lot of surrounding bone to go ahead and place that implant. So all these factors really come into play when we're talking about placing an implant. And so when we place an implant, what we're trying to do is we're trying to strategically place it in a very precise location so you can avoid something called cantilever, so that we can make the screw retained. And also, so there's a lot of complexity that you patients probably have never heard about, but these are the little details that we want to go into, that we take into account when we're placing a dental implant. Now, of course, we always want to make sure that a patient can minimize their appointments and also go through less painful procedures and save time, but at what cost, right? And so everything has to be weighed, and that's why in this case, we decided to tell this patient, hey, in your best interest, if this was my mouth, then I would go ahead and just take this tooth out. We're going to bone graft it. We'll see in 4 months, and we'll go ahead and place this implant. Now, I placed multiple implants on this patient, so he's been through the whole process already. He's very familiar with it, so he was happy to hear that and just wanted to make sure that he would have the best result for the long term. Okay, so this was the other surgery that I had planned for an immediate implant. So this was a patient who had severe cavity and that was really close to the bone on tooth number 5, which is the first premolar on the right side. So we had to take that tooth out. And so these premolars are always great candidates to get immediate implants. Again, immediate implant means when we take out the tooth and we place the implant the same day. So whenever we're looking at to see if a patient is a good candidate for this, this is the tooth in question. Again, there's a huge cavity right there. And I love the bone on the bony dimensions for this patient. This patient not only has very wide bone, but this patient also has a lot of bone before they get to the sinus. And that's actually when I tell patients in regards to like candidacy for immediate implants, I always tell patients that premolars are always typically great candidates to get immediate implants. Obviously, we again have to look at the anatomy of the patient because everyone's different. If we're talking about lower teeth, then we're always concerned about the inferior alveolar nerve. And if we're talking about upper teeth, then we're going to be concerned about these sinuses, right? And so everybody's got maxillary sinuses, and what they are is just air-filled cavities. So you want to make sure that if you're doing an immediate implant that there's going to be plenty of bone. So again, this patient doesn't have big sinuses. So this patient was actually a very good candidate to get immediate implant. So just kind of like what I was looking for was I made the measurements to make sure that this patient had plenty of bone. And so what I was able to do was I was able to take that tooth out and place the implant at the same time. And so you could see here that we placed this immediate, and this right here is the helium abutment on top of that. So again, to kind of just sum it up in regards to like who would be an ideal candidate for immediate implants, you want to make sure that you're not too close to the sinus, because the sinuses, if you're placing an implant up into the sinus, you're not going to have any bone stabilizing that implant. Again, because it's an empty air cavity, you don't want to have the majority of your dental implant just hanging out in the air and not getting any support. And again, on the lower, you want to make sure that you're staying away from the nerves and stuff like that. Now, if you do see that you're too close to the sinuses, you're too close to the nerve, again, the better approach to do is to make sure that you don't have any complications in the future, is to do the bone graft, come back in about 4 months, go ahead and get that implant. You're gonna have to wait again the next 3 to 4 months. So it is a longer period of time. That is the biggest advantage of of immediate implants, is that you can really cut down on that time and the number of appointments. But again, you don't want to compromise the long-term prognosis of your implant. So hopefully you guys were able to learn a little bit with those about the pros and cons of immediate implants. Again, I love to do immediate implants for patients because we can really cut down on the time and the number of appointments for the patients. But again, we want to make sure that that implant is done correctly. So if you guys have any questions, please feel free to leave them in the comments below. All right, thank you.